and making sure that health care reform really works. We're going to go quickly through this, and we can see that the idea here is to promote health care coverage. The law calls for Medicaid coverage expansion. Anyone up to 133% of federal poverty level by 2014 can qualify for Medicaid. We're going to create exchanges, marketplaces with premium subsidies. There will be employer-sponsored coverage that will give penalties for those that don't provide coverage and tax credits for small businesses that need help getting their purchasing their coverage for employees. There will be an individual mandate. In other words, if you don't have health insurance, there will be a penalty to pay. And this is an area of great controversy. Is it constitutional to demand that individuals be mandated to have insurance? Hopefully, we'll see it the best thing for the nation in health insurance market reforms. No more dropping people when they have an illness and charging extremely high rates. So to go quickly then, 2010, there are some things that are already happening, and you may have heard about these things. For 2010, we wanted to get off by creating pre-existing risk pools for pre-existing conditions, allow adults, children to remain on their parents' health insurance policy till age 26. They don't have to stay in the house, but thank goodness. And they don't have to be on your taxes either. So, but if they're married and they have children, they're not eligible. But this is a big help because this group is really at risk. And so, 2010 early actions, a number of things have happened. By 2014, we're really going to take off. And the care will be expanded because by 2014, any adult will be eligible for Medicaid if they are within 133% of the federal poverty level. And about 50% of those newly eligible will be New Jerseyans with ethnic and racial minority status. Premiums will be provided through subsidies. Individuals will be able to shop the health care markets, the exchanges that we're creating, and certainly up to 400% of federal poverty level, an individual or family will be able to get insurance through the health exchanges. So what will happen is by 2019, the hope is that the uninsured will decrease from 19% as it is now to 8%. And certainly there will be a pickup in Medicaid of about 16 million, exchanges and private insurance, 16 million pickup. And so we'll be well on our way to covering an additional 32 million people, which is one of the big problems that we have with healthcare disparities, is to get coverage for individuals. Improving health insurance, of course, reform the insurance market. We're going to be much more strict under the law on health insurance companies and make sure that individuals get benefits that really provide the kind of coverage they need. Employers that don't provide insurance coverage will be penalized starting in 2014, certainly. Those that have small businesses, up to 50 employees, will be exempt from the penalties. The beautiful thing is that tax credits for small businesses that offer health benefits will help 141,000 minority-owned small businesses in New Jersey. Fewer than 53% with less than 10 employees now provide health insurance coverage. And doctors with small practices, small offices, here's an opportunity for tax credits for your businesses that will be available under the law. We do know that the individual mandate is an area of great contention, but it is an important one because only through mandating that everyone have health insurance can we really expect the insurance companies to provide coverage for everyone. There has to be enough of a pool there for them to be able to cover the sickest of the sick, and the mandate will be enforced through the tax system, so there will be penalties if you don't really want to have health insurance, as it will be mandated. There will still be some who won't be covered, of course, about 23 million. Some of those individuals, of course, are immigrants who don't really qualify as legal residents. One of the big problems is getting people to enroll in Medicaid. Even though it's available, the enrollment or what's called the uptake is not always where you want it to be. It's about 88% in Massachusetts, for example, but in other states it's as low as 61%. So you can't guarantee that everyone's going to enroll. Now, what about healthcare reform? Well, here's where we really have to get busy at East Orange and many other places, the medical staff. We've really got to change the way that healthcare is delivered and be involved with the process of promoting preventive care and primary care, mammograms, colonoscopies. These things will be without copay. You don't have to pay for those anymore. And this is to emphasize preventive care. The provider supplies, we need primary care doctors. There are a number of new models of care that maybe we have a little time to talk about. Technology, Kevin mentioned that we are going to get electronic medical health records as well as computerized physician order entry. These things are critical in order to improve efficiencies and to make